Hello all, welcome back to Medcode Navigator. Today's topic is biopsy procedures. First, we'll see the definition of biopsy. A biopsy is a procedure that involves taking a small sample of cells or tissues from the body so that it can be examined under a microscope. Biopsy is done for diagnostic purpose and can help determine the type of the disease. During some surgical procedures, especially in the integumentary system, such as excision, destruction, or shave removals, the removed tissue is often submitted for pathologic examination. So, these type of biopsy is included in that surgical procedure itself. So, we cannot bill it separately. So, if biopsy is performed along with excision procedures means we should not code biopsy separately. Okay. We have three types of biopsies. One is tangential or shave biopsy. Second, punch biopsy. And third, incisional biopsy. So, tangential biopsy, example, shave, scoop, saucerize, curate is performed with a sharp blade, such as a flexible biopsy blade, obliquely oriented scalpel, or curate to remove a sample of epidermal tissue. So, the tissues are of partial thickness. The tissues were taken from the epidermis or dermis layer. So we have two codes for tangential biopsy. So biopsy அப்படின்றது small piece of cell or tissue remove பண்ணி pathologyக்கு send பண்ணி என்ன type of disease அப்படின்றத find out பண்ணுறதுக்காக பண்ற ஒரு procedure. Okay. Next, punch biopsy. Punch biopsy uses a punch tool to remove a sample, and the samples are of full thickness cylindrical core. Mostly it will cover epidermis, dermis and subcutaneous tissue. If you want a clear visual explanation of punch biopsy tool and scalpel, check out my previous video, link in the description. So for punch biopsy, we have two codes, that is 11104, 11105. Incisional biopsy uses a sharp blade, not a punch tool, to remove a full thickness wedge sample. Okay, and it is more deeper than punch. So we have two codes, that is 11106 and 11107. So biopsy code ranges from 11102 to 11107. So the most important guideline under biopsy is multiple biopsies. When multiple biopsies were performed on the same day, we have to verify the type of biopsy, whether it is same or different types, that we have to verify. If the biopsies are of same type, then we have to use the primary code for that biopsy once, and for the rest of the biopsies we have to use the add-on code. If the biopsies are of different type, we have to code the most complex procedure as primary. For the rest of the biopsies, we have to use the add-on code corresponding to that biopsy. Okay. So multiple biopsies perform பண்ணியிருந்தாங்க அப்படின்னா ஃபர்ஸ்ட் அது சேம் டைப்பா இல்லை டிஃப்ரெண்ட் டைப்பான்னு பார்க்கணும். ஃபார் எக்ஸாம்பிள், மூணுமே பஞ்ச் பயாப்சி டிஃப்ரெண்ட் சைட்டில் பண்ணியிருக்காங்க அப்படின்னா we have to use 11104 as primary, and for each additional we have to use 11105 into 2. Okay, if it is two tangential biopsies means we have to use 11102 once and 11103 once. If the biopsies are of different type, That is, one incisional, one punch, or one tangential biopsy means then we have to use the complex procedure as primary. So, which one is complex here? Incisional is complex. So, we have to use the primary code for incisional biopsy, that is 11106. And for the rest of the biopsies, we have to use the add-ons corresponding to that biopsy codes. So, it will be 11105 and 11103. We'll see the sample CPC exam question. Provider performs punch biopsy on arm and shave biopsy on back. So for this, the right answer will be 11104 and 11103. Since punch biopsy is complex than shave biopsy, so we have to use the primary code for punch biopsy first. That is 11104, and we have to use the add-on code for tangential biopsy. Okay, that is 11103. I hope you are all clear with this concept. If you have any doubts, please mention it in the comment section. I'll reply to you. Thank you for watching. Bye bye.